Good evening. Just a moment while I collect my notes. As you may have noticed if you've been following my channel at all, I put up a number of videos reading from my books and pamphlets about the privatisation of the NHS. This has been going on by successive right-wing administrations since Margaret Thatcher and has included Tony Blair, who introduced much private provision into the NHS to the extent that the people said that he'd gone much further than the Tories had dared. Now, the NHS is in crisis, and I am not reassured by the Tories' attitude to it. They seem to be pushing ahead for the privatisation. Last week, 38 Degrees, the internet petitioning organisation, sent round a petition for people to write to their MPs expressing concern about the way Rishi Sunak had used funding for the NHS to build 6 private hospitals. Not public hospitals, private hospitals. Now, I wrote to my local constituency MP for South Bristol, Karin Smyth, and the other day I received a reply, and it says, "Dear David, thank you for contacting me to raise concerns about NHS privatisation. The NHS is our greatest institution, established 75 years ago to provide universal health care free at the point of use. I am committed to upholding its founded principles as a comprehensive, integrated public NHS that is there for all of us when we need it. A right afforded to everyone regardless of ability to pay. Many people are understandably concerned at the serious pressures facing our NHS. Despite the heroic efforts of staff, waiting lists have risen to over 7 million and hundreds of thousands of people are waiting longer than a year for treatment. On all measures, patients are waiting longer than ever before. Ministers point to the impact of COVID-19, but we entered the pandemic with record waiting lists and 100,000 staff vacancies. Building an NHS fit for the future is my priority, reforming health and care services to speed up treatment, focus on prevention and reduce health inequalities. We must build capacity in the NHS, providing it with the staff and resources it needs, so that all patients are treated on time again. But I believe we have a responsibility in the short term to utilise spare capacity in the private sector to get through the current crisis and bring down NHS waiting lists. Nobody should be left languishing in serious pain while those who can afford to pay to go private. That is a two-tier healthcare system that I and my colleagues want to end. In the long term, I want the NHS to be so good that people will never have to go private. There is, in my view, an incompatibility between the aims of private companies and the aims of the NHS. We must end the reliance on outsourcing and the cronyism that, in my view, saw public services weakened in the face of the COVID-19 pandemic, and instead build resilience in the NHS, making sure every penny of taxpayers' money is spent wisely. Nye Bevan, who spearheaded the creation of the NHS, said in 1948 that this service must always be changing, growing and improving. I support a 10-year plan of investment and reform that seeks to do just that, dealing with the root causes and immediate challenges while building an NHS that is fit for the future. Thank you once again for contacting me about this issue. Yours sincerely, Karin Smyth MP, Labour MP for Bristol South." It sounds good, and I am convinced that she is genuinely concerned about the privatisation of the NHS. But I don't believe this about Keir Starmer or the rest of the Labour front bench, or I have severe doubts. It's because of Starmer's worship of Blair and his policies. Blair stood for privatisation, and before he started introducing more privatisation into the NHS, he was there, "Oh, we're not going to do it. Oh, we stand for the NHS. Oh, we're not going to let the Tories privatise the NHS." And now he's come out and he said, "I want more there ought to be more private provision in the NHS." Now, you can tell the idolisation of this man by the fact that the Labour shop a little while ago was selling mugs of Tony Blair and I think Peter Mandelson. And there was a fundraising meeting for the Swindon Labour Party in which you could pay something like £120 for dinner with Peter Mandelson. Well, as Bill Hicks said, pull me up a chair. Anyway, I wrote back to Karin, and this is my reply to her reply. Dear Karin, thank you for your kind reply to my concerns about NHS privatisation. I have been very impressed by the concern you've shown for the health service and the work you have done on behalf of your constituents. I regret to say, however, that your reply has not allayed my fears. This comes from the character and career so far of the current leader, Mr. Starmer. He began his leadership with promises that he would continue Jeremy Corbyn's policies, while obviously campaigning against anti-Semitism in the party. Yet he has gone on to break those election pledges and has continued to do so almost up to the present date. Last week, Angela Rayner promised a group of Scottish apprentices that Labour would expand their rights at work. These policies have been drawn up by the responsible organ of the Labour Party. Unfortunately, the very next day, or so it seemed, Mr. Starmer then quashed this promise. He has broken so many promises and electoral pledges that he comes across as extremely untrustworthy. I also have very strong doubts on the desire of the Labour right to preserve the NHS. As I understand it, much of the chaos facing the health service comes not just from decades of Conservative underfunding, but also from decades of privatisation. These have raised administration costs and produced an expanded bureaucracy in order to continue to coordinate the private healthcare companies and operators that have entered the NHS. Tony Blair, in many people's opinion, went further than the Tories dared in opening up the NHS to private healthcare companies. His legislation for the provision of alternative care allowed the primary care trust to commission services from private healthcare companies. He also opened hospitals up to such companies through their provision of specialist equipment, such as MRI scanners. The polyclinics set up by Blair were also intended to be run by private companies, such as Care UK and Virgin Health. Mr. Blair also introduced legislation to allow private hospital chains like Nuffield, BMI, Spire and Ramsay to take over the running of NHS hospitals. And under the framework for procuring additional external support for commissioners, private health insurance companies were also to be involved in all aspects of the provision of care. I also understand that when New Zealand introduced its policy of using private healthcare companies to deal with its patient backlog, it was intended as the prelude before the privatisation of their health service. And it has been reported that Mr. Blair's Health Secretary, Alan Milborn, wished to replace state provision entirely, leaving the NHS only as a kite mark for services provided by private companies. Mr. Blair and his team are huge heroes to Mr. Starmer and his supporters. This makes me very concerned that he will follow Blair into the further privatisation of the NHS, especially as Mr. Blair last week opined that the NHS needed to introduce more private provision. I have no doubt, reading your reply, that you are personally committed to saving the NHS, but I would also appreciate it if you could provide further proof that the Labour leadership shares your concern. Could you provide details of any publicly available policy documents giving details of plans by the leadership and party to cease privatisation and start renationalising the NHS? Yours sincerely. I'd be really overjoyed if the Right Honourable Karin Smyth would get back to me on this and could point me to just such a policy document. But as it stands, I see Starmer heading towards a Labour government, and I look at what Blair did, and I don't want to be fooled again. Thank you so much for listening.